Okay, shall we get started now? Look, it's 5 past. I'll just let anyone else in, any latecomers.
Yes. So, good evening, everyone. My name is Shlok. Uh, I hope you can hear me because I cannot see you all, nor I can hear you all. Okay. So, and if you hear any baby noise in the background, please don't mind. I'm at home, and my son has just turned 8 months, so and he's learning a lot of new skills. So yes, thank you for joining us for the first of our new webinar series. We decided to launch this webinar series after many conversations with the families, and they told us that they feel unsure about where to start after a dementia diagnosis is done, both in understanding what it means and in finding the right support locally in Bromley. And our aim across these 4 sessions is to give you a clear understanding and introduction to dementia, share practical tips, and help you as a carer. And we'll try to signpost you to the support that exists here in Bromley as well as in Orpington. So, furthermore, this session will also be recorded and we will share the recording with everyone afterwards. So you can revisit it. So and please do pop up your questions in the chat as we go through, and we'll try our best to answer them at the end or as we go through. Okay. Uh, yes, I'll pass it on to Katie.
Hello everyone. I'm Katie Brooks. I'm Community Engagement Officer at the Rainbow Care Group. Today we're planning to cover understanding what a dementia diagnosis really means, making sense of the information that you've been given, what changes you might notice in your loved one over time, some of the support and treatments that are available, and providing some reassurance and practical next steps for families.
Okay, so coming on to the main question, what is dementia? There's a lot of information available online. There's a lot of people making TikToks about it, Instagram, Facebook. So get let's try to keep things simple and we'll try to answer it as easy as possible. So basically, dementia is an umbrella term and it's not a single disease. And dementia is just like saying cancer or a heart disease. And it describes a group of conditions, I would say a neurological conditions rather than one specific illness. And different diseases can cause dementia, and which is why people may hear different names from their doctor, such as Alzheimer's and vascular dementia, FTD, right? Um, and next is it describes a group of conditions that affects the brain. So basically, dementia is caused by the diseases of brain itself, and it is not caused by stress, personality, or something that person has done wrong. And the brain is an organ, just like any other organ, and it can become unwell. Apart from that, it can affect memory, thinking, communication, and daily life. So, memory is often most talked about symptom, and if dementia can also affect problem solving, finding right words, understanding conversations, planning, managing everyday tasks like cooking, money, or medication, right? Or even using your phone. And it is caused by physical changes in the brain. So when brain cells become damaged and connection between them don't work well, this is uh, this is why changes in behavior and abilities are not deliberate. So the brain is literally trying to process the information differently than it used to. And one of the most like people have a myth that dementia is a normal part of aging. A lot of people have misconception about it, but it is not. So yes, memory can change with the age, but dementia goes beyond normal aging process, and it interferes with daily life and independence. This helps family understand that diagnosis reflects a medical condition and not just getting older. Okay, I'll pass on to Katie. for the next one.
So talking a bit more about the difference between dementia and normal aging, as Schlock said, some memory change is a normal part of healthy aging, but dementia goes beyond that. With normal aging, it can be normal for individuals to take longer to recall names or details, but that doesn't necessarily mean that something is wrong. So many people, as they get older, have mild memory slips but still manage their daily life independently. Most older adults live full, independent lives. We all might occasionally forget where we've left our keys or struggle to recall a name, but can still manage routines, make decisions, and learn new things. Not all memory loss means dementia. Memory loss exists on the spectrum. Just because somebody notices changes doesn't automatically mean that they have dementia. Many people experience mild memory changes that never develop into anything more serious. Mild cognitive impairment kind of sits in the middle between healthy aging and dementia. It's a recognised condition where memory or thinking changes are more noticeable than normal aging, but daily life is still mostly unaffected. People with mild cognitive impairment usually still live independently, but they do have a high risk of developing dementia later on. Dementia causes memory and thinking problems that do interfere with daily life. It's diagnosed when these changes are significant enough to affect everyday activities. As Schlock alluded to, this could include things like managing money, following recipes, keeping on top of appointments, and learning new information. With dementia, the changes are noticed by people around the individual, and sometimes it might be noticed by sort of friends and families before taken on board by the individual themselves. And also it's a progressive condition, so tends to worsen over time, though the speed and the pattern of progression does vary significantly between individuals.
Okay. So before we move further, I wanted to ask if anyone have got any questions so far. Anything? I cannot see the chat. Katie, can you see the chat?
Yeah, I can see the chat. Nothing in the chat so far.
Nothing in the chat. Okay, that's great. I wanted to ask one question. If anyone knows that how many types of dementia are there, can anyone answer that?
Put it in the chat if you know the answer. Nope.
No, that's fine. So I'll answer that question. So there are over 200 types of dementia. Over 200 types of dementia conditions basically. So and symptoms and condition doesn't look same in everyone in terms of so yes, basically everyone has got different personalities, so everyone processes same emotions differently. In that same way, different I was keeping quiet. Okay, that's fine. um, People can every individual can take uh, every individual can process dementia differently, uh, and it depends on their personality as well. Some di different types of dementia can cause different and early symptoms and affect how quickly the change may happen. Some treatments are more powerful and more helpful for certain types, and knowing the type can help people and plan the care for their loved one. It also should be noted that out of 200 types of dementia, only one of the condition is reversible, which is Korsakoff syndrome. Rest all of them are irreversible. Uh, we'll talk about different types. So Alzheimer's disease is one of the most popular type of dementia. It accounts for more than 70% of the cases, and it usually begins very slowly. And the main symptoms are linked with memory problems, and it gradually affects thinking, language, and everyday functioning. changes in the brain affect areas involved in forming and storing new memories. So basically, person is not able to make new memories. Second most popular type of dementia is vascular dementia, and it is caused by reduced blood flow to the brain, often linked to the strokes and small vessel diseases. So if anyone gets a stroke, there are chances that they can get vascular dementia, but not all the strokes can cause vascular dementia. That is also the case. And symptoms can appear suddenly or progress in steps. People may have more problems with planning and decision making, and concentration as well, but the memory problem is bit less with vascular dementia. Uh, the third most popular type of dementia is Lewy body dementia. It accounts for 5 to 10% of the cases. So Lewy body dementia involves abnormal proteins depositing in the brain cells. So people may experience changes in attention, visual hallucinations, sleep problems, movement symptoms. They can get fidgety movements, and their limbs can get stiff over time, right? And a lot of the symptoms are uh, they basically overlap with the Parkinson's disease as well. So anyone who gets Lewy body dementia, the doctors also advise them to get diagnosis for Parkinson's as well. And with Lewy bodies, memory is less affected in the early stages. Uh, Moving on to the next one is frontotemporal dementia, which accounts for 2 to 5% of the cases. It is also called FTD. Frontotemporal dementia, it affects the front and the sides of the brain, which controls behavior, personality, and language. People may show changes in behavior, judgment, and speech before memory problems become obvious. And it often affects people at a younger age. Uh, FTD basically, a lot of people who are involved in high impact sports can get FTD at much younger age. The youngest case of FTD noted is, I think, about 14 years of age, right? So it is quite sad. Uh, then the last one is mixed dementia. It accounts for about 2 to 5%. And many people who have got more than one type of dementia at the same time, the most commonly would be the Alzheimer's and vascular dementia together. So the symptoms would be the combination of both of them, right? So yes, these are the most common types of dementia. There are other types as well, such as Korsakoff's disease, Peak's disease, Huntington's disease, but it is not possible to cover all of them in just one session, right? So we'll keep it for maybe some other day. Uh, Moving on to the next one, I'll let Katie.
Lovely, thank you. So in terms of some of the early signs of dementia that people might notice, there's of course recent memory loss, so difficulty remembering recent events and tasks and conversations is a common early sign. People might remember things from years ago more clearly than what happened earlier in the day or who they've spoken to recently. Difficulty with regular tasks, so tasks that were previously completed on autopilot, such as cooking familiar meals, might suddenly become more difficult. Using household appliances, managing finances, or following routines. This can feel really confusing or overwhelming for the person with dementia, even though the tasks were once automatic. There's time and place disorientation, so people might lose track of dates, seasons, and the passage of time. They might become confused about where they are or how they got there, even in familiar places. And again, this can cause anxiety and distress. Language problems, and people might have trouble putting their finger on the right words to use, following conversations, or understanding what others are saying. They might substitute the incorrect words in places, pause a lot, or lose their train of thought mid-sentence. Poor judgment, so people might show changes in their decision making, such as making financial decisions they wouldn't have previously, becoming more susceptible to scams, or taking risks that they previously wouldn't have taken. Misplacing items, so people might put things in unusual places, the car keys in the fridge, or the remote control in the cupboard, and then sort of be unable to retrace steps to locate those items. Personality changes, so people might seem change sort of different from how they used to be. They might become more withdrawn, suspicious, irritable, or less empathetic, and these things are caused by changes in the brain and certainly not by choice. Mood and behaviour changes, so people might experience anxiety, depression, agitation, or frustration. They might react more strongly to what seem like smaller problems. And these external changes are common and can be very difficult for families to deal with. Abstract thinking problems, so problems can emerge with thinking about numbers, money, or following sequences. For example, managing bank accounts might become a challenge, understanding bills, or following steps in the right order. And loss of initiative, so people might lose interest in things that they used to enjoy, need more prompting to initiate tasks, socialise, or take part in hobbies and try new things, and this is due to changes in motivation and planning in the brain.
Okay, so we have covered a lot of things. Now we'll see how dementia may change over the period of time. We all know that dementia is a progressive disease, but the pace at what it progresses, it varies for everyone. So for most people, the symptoms tend to increase over the period of time. And however, how quickly this happens, it varies greatly. And some people may change slowly over many years, while others may change more quickly. In our clubs, we have few members who, if you speak to them for one instance, you won't even feel like they have got dementia because there's symptoms, but it is only after talking to them over a certain period of time you'll understand that okay, they're repeating themselves a lot, right? Yes. So changes often happen gradually over months and years, especially with Alzheimer's. It sometimes can take about 10 years to even identify that someone might have got Alzheimer's. So, and families may not notice big changes day to day, but when they look back, like over 6 months or a year, the difference can be clearer. And this gradual change makes it harder to recognize that how much support is needed. Um, and the support needed is usually increased over time, so people may gradually need more help with daily activities such as cooking, managing medication, personal care, even getting out and about safely, planning ahead, and this kind of things can help transitioning little less stressful. Um, then abilities can fluctuate from day to day. So people can have good days and bad days like every one of us. So, but fatigue, illness, and stress and change in routine can all affect how someone is functioning on a particular day. Some things can trigger certain things, but best thing is that a difficult day does not always mean that a sudden decline has happened. Okay. We all face difficulties, right? So, uh, and every person's journey with dementia is different, so there's no simple and typical pathway. Two different people with same diagnosis may have very different experiences, and so this is very helpful when it will help family to avoid unhelpful comparisons, and we can focus more on the individual itself. And physical health and other illnesses can also affect the symptoms. So, infections, pain, dehydration, medication changes, hospital stays can temporarily make dementia symptoms much worse. Uh, this does not always mean that dementia itself has suddenly progressed, but it can vary, uh, and it can be alarming for the families as well. We had someone in our club. So they went to the for a respite care in one of the care homes for just 2 weeks of time. But after 2 weeks, when they returned back to us, they were like that symptoms were worse than they were when they were with us. So things can change suddenly as well, I would say. So it depends on what kind of simulation they get wherever they are. I'll pass it on to Katie next for the next slide.
So as we've mentioned there, dementia affects more than memory. You will see changes in mood and emotions. We've covered a bit on that in terms of low mood, frustration or irritability that might be experienced, changes in personality, changes in sleep patterns. So people might find themselves sleeping more during the day and being awake more at night, or confused about the passage of day and night, and this can be particularly exhausting for carers. It's a very common issue. Changes in behaviour, so people might pace, repeat actions, become agitated or become distressed more easily. And some of these behaviours are often a form of communication showing unmet needs, confusion or discomfort when the person is unable to articulate those needs that will show up in their behaviour. Changes in sensory experiences, so some people might misinterpret things that they see or hear, or experience hallucinations, particularly in some of the dementia types like Lewy body. Lighting, shadows and background noise can become confusing things. And changes in awareness and judgment, so people may have reduced insight into their difficulties and might underestimate risks, affecting some of the areas around finances, driving, vulnerability that we've discussed.
Yes, so we have covered so much about what can happen to the person. We'll see what we can do for them. Okay. First one is medication. Of course, we should leave this part to the doctor. Anyways, some medication can help with symptoms or of dementia for some people, particularly with memory, thinking, agitation, or attention. And they do not, so basically, they do not cure dementia, but they stop or not they stop in progressing, but they help people functioning better for a period of time. Okay. And next is mind simulating activities. This is what we can do at home as well. So activities that engage the brain, such as simple puzzles or conversations, reminiscence, games, or any kind of structured cognitive simulation, it can help people stay engaged, and it may support in thinking skills. Music and creative therapies. So music, singing, art, and other creative activities can be very powerful. And music is stored in that part of the brain which dementia cannot affect. So it particularly it is very magical, I would say, and it reduces anxiety, it lifts mood, and it triggers memories, even in the later stages of the dementia. Uh, Next is lifestyle changes, staying physically active as much as possible, eating well, keeping a routine, and staying socially connected can all support overall brain and physical health. And these changes do not cure dementia, but it can help people feel better and function more effectively. Uh, then is the next is managing other health conditions. So untreated pain, infection, hearing or vision problems, dehydration or medication side effects can make dementia symptoms much worse. So if someone has got dementia, it's best to treat the other health conditions as soon as possible. It will definitely help in bringing improvement. And then support for mood, sleep, and well-being. So anxiety, depression, poor sleep, and stress, they are all common in dementia. So supporting emotional well-being and sleep can significantly improve quality of life for both the person and the carer. And again, for this, the more person is physically active, it will help them to sleep better. Yeah, uh, Katie, you can take it forward from here.
Now, I'm hoping that in a second, when I press the button, it's going to show a video, a short video from one of our clubs that shows some of these activities around cognitive stimulation underway. The video is part of a series that Schlock's been making on his mission to support 250 families in Bromley with dementia this year. So if you want to see any more of these videos, give us a follow on Facebook or Instagram, but let me give this a try.
Choice is the one thing dementia shouldn't take away. Day 9 of my mission to support 250 families. When people see this, they see a hobby. But what's actually happening is cognitive simulation, helping our members find that when they still deserve to fail. Music lives in a part of brain that dementia can't reach. This isn't just a sing-along. It's a reminiscence. It brings back the person they have always been. Physical play fights the isolation dementia brings. It's about the sensory spark of competition and the simple joy of being part of the team again. Whether it's a new hairstyle for James or just a quiet moment looking out of the window for Doug, this is the heart of person centered care. Families often tell me their loved ones are calmer and sleep better after these sessions because they have finally had a day of real engagement. I know the guilt of seeking help can feel heavy, but your loved one isn't just being sent away. They're coming here to live. If you need a moment to breathe while they get the engagement they deserve, reach out to us. We are here for both of you. See you for day 10.
That was me. Yes. Uh, so yes, I don't know how many of you know about us. We are Rainbow Care Group, Bromley territory. So we are a dementia day care service providing compassionate, person-centered care for people in our community and who are living with dementia. And we run our day clubs from peaceful and community settings to ensure that the day does not feel clinical or institutional. And we have got two clubs at the moment. One is in West Wickham, that which is at Coney Hall Football Club, and the other one is in Orpington at Holy Innocents Church Hall. And we won't have more than 12 members in each session. We have got highest staff ratio with 1:4, and we do a lot of things. When sorry when your loved ones are with us, we entertain them, we play games with them, we take them out for day trips, we go to pubs, we go to gaming arcades. Today itself we went to a museum of Croydon. Yeah, we do a lot of fun activities. We feed them, we spoil them, we make sure they have a very good and engaging day throughout the time when they were with us. And we try our best to give them the best simulation possible. And we make sure that everyone gets to do what they like to do instead of just dictating any activity for them. And yeah, we love to do this job, and we are proud of what we are doing.
Thank
Move on
you.
next, Will. Thank you.
Yeah, you mentioned that you had, thank you for that. It was really helpful, very interesting.
Yes.
You mentioned that you had a Facebook page. What's that called? So I'd like to get on that.
So it has got the same name, Rainbow Care Group Bromley.
Okay.
If you search that.
Yep. No, I'll definitely join that. Thank you.
Definitely. Yes,
I'll
please.
send it out as well after this with the recording.
Oh, well done. Thank you. That'll be great. Yes, our relative's in a care home.
Okay.
And she's now coming down with dementia. It's going down Alzheimer's, and
I
she's
see.
making quite a rapid decline. I think one of the things we've noticed a lot is that she was a very, very active person, very, very enthusiastic. I think one of the key things recently is that she's lost her enthusiasm, albeit there's a whole load of things going on at the care home, but she's saying, no, I don't want to do that anymore, or something like that. Yeah. So it's a question of trying to G her up. And the other big thing we've noticed as relatives is that we used to argue and say, no, that's not right, you're wrong about that. And we don't do that anymore at all. So we just try to live in the present, just change the subject and move on to something else, you know. So
Yeah, definitely there is no point in arguing, and because they might be living in some other reality, right? They might be living in some other time. So it's best to meet their reality, match their reality, whatever they're saying. Of course, it's not that we should agree with everything, but it should be realistic with what they are thinking, how they are thinking and processing it.
Yes, I think we've changed considerably. When it felt, no, that's not right, and we don't say that anymore. You know, you just move on and change the subject.
Yeah, that is the best approach.
Shall I skip forward to the what helps day to day slide, because we're kind of on that topic?
Yeah, why not?
Yeah.
So in daily basis, first thing is keeping a regular routine is very important. Predictable daily routines help people with dementia feel safer and less anxious. Doing things at similar times each day, it reduces confusion and it can improve sleep, mood, and cooperation. We have someone in our club. So when we started up, we were operating just 3 days a week. So because of the routine they build up, like coming to the club that person, he used to think that even on the days when he was not attending, he would get up every day, he would get ready, and he would think that he's going to the club because he thinks that this is his place, this is his routine, right? And that's so helpful that his wife decided that he she decided that she would send him to us every single day. So now we are operating 5 days a week. He attends 5 days a week. Second is clear and simple communication. Using short sentences, one idea at a time, one instruction at a time, and giving plenty of time to respond. It can make conversations easier, and we should avoid correcting and arguing wherever possible. And we should focus on the feeling behind what is being said rather than what words they are using, right? Sometimes what they are saying, it might not reflect what they might be feeling, right, and what they might be asking for. A lot of time, what I have seen at the club, that uh, the person would say, I want to go home. They would insist that they want to go home, but in actual they just are, they want to use toilet, or they just are hungry, right? So it can be different. Third is familiar and calm environment. So familiar surroundings help people stay oriented. Too much noise, clutter, or change can increase confusion and distress. So simple changes like good lighting and clear signage can make a big difference. Then breaking tasks into small steps, that is very important. I have seen that mostly anyone with dementia, it's best to give them one instruction at a time, and complex tasks can become overwhelming. So breaking activities into simple and manageable steps can help the person stay involved and feel more successful. And allowing extra time and patience. So processing information, it it gets bit difficult with dementia. So rushing can increase anxiety and mistakes. So slowing the pace often leads to better outcomes for everyone. and adapting expectations over the time. So ability will change with dementia. Things they used to do last month or even 1 year ago, they won't be able to do at present, or it may get harder for them to do right now. So adjusting the expectations will help reduce frustration among the family members, and it would keep the relationships intact. uh yeah, that's it from me on this slide.
So I'm conscious we're getting to the end of the time we had, but we've just got a couple more slides to get through. And this one is, of course, really important, looking after yourself as a carer. So being a carer for someone living with dementia is obviously very emotionally, physically demanding, and takes a lot of time, energy and emotional strength. So it's completely normal to feel tired, frustrated, sad or overwhelmed at times. And it's certainly okay to ask for help. Needing help is not a failure, and it doesn't mean that you're not coping. It just means it being realistic about what one person can manage on their own. Dementia is a condition that does often need a team approach. Your well-being affects your loved one's well-being. When you're exhausted or stressed, it can affect your patients, communication, decision making. So looking after yourself helps you to look after them. Taking regular breaks can help you to cope long term, even if it's small ones. A small break can help reduce carer burnout, whether this be through help from family and friends, day services or respite care can all make a big difference. Support can reduce stress and burnout, so you might seek out carers cafes or groups where you can meet people in similar situations, and that can help with feeling less isolated and more confident. And you're not alone in what you're doing. There are many families tackling similar situations and on a similar journey, so support is available out there for not only the individual with dementia, but for their family and friends and carers looking after them too.
Yeah, so yes, support is available. Of course, we don't know what is available. That's why we are here. So we should talk to our GP. Try talking to your GP or any memory clinic. So these places remain key points of contact for medical advice, medication reviews, and referrals to other services as well. So, and keep notes and keep asking questions to raise new concerns as things change. And access local dementia and care support services. Local charities, councils, and community organizations can offer practical support, education, and emotional support as well. And these services can reduce isolation, and it can help family feel more confident with whatever they're going through. And consider day services or respite options. Day services like ours can provide meaningful activities for the person with dementia and valuable breaks for the carer. And respite is all about sustaining care and not giving up. Families who who have already joined us, they get so much time for themselves to do so many things. So I have they say positive things about us, so I'm very flattered about that. I'm proud of what we are doing. uh Next is getting advice on benefits, legal and financial planning. So early advice on things like power of attorney, benefits, and future care planning can prevent stress later on. So doing this as early as possible can give families more choice and control, because we don't know when things might take U-turn, right? So it's better to plan things forward as soon as you know that you notice something. And share information with family and friends. So keeping others informed can help build a wider support network. So people often want to help, but they do not know unless they are included. And I have seen that a lot of people, they would keep it secret that they are going through something. They keep it hidden. but it's not helpful. And their loved one can decline very quickly if they do not get right support at right time. And last but not least, don't wait for the crisis to ask for help. This support works best when it is put in a place early. So waiting until things become unmanageable makes everything harder and more stressful. Right. So yeah, getting help as soon as possible is very important. Uh, we have there are a lot of organizations in the community, just such as Oxalis, Bromley Dementia Support Hub, Bromley Well is there. For legal help, Thakre Williams is there. Alzheimer's Society, Age UK, and we are there, of course.
So that's taken us through most of what we had. So for some key takeaways, a dementia diagnosis doesn't change who your loved one is. They're still the same person with the same life story and the same need for respect and connection. Dementia affects their abilities, not their value as a person. You're not alone in this journey. There are many families going through similar experiences and lots of community groups that you can become a part of that are actually really positive, fun places that are often just full of love. So, you know, definitely not on your own. There's support available for both the person and the carer. Small changes can make a big difference. So some of the practical adjustments that Schlock mentioned making in terms of reducing clutter or loud noises, adjusting how you're communicating and in keeping regular routines can make a big difference. Asking for help is a strength, not a failure. Many carers feel they should cope alone, but early help prevents burnout and kind of safeguards your way of living into the future. And early support gives you more choices and control. So planning early allows families to make more informed decisions and avoid being forced into making urgent choices later on.
So yes, we have 3 further webinars coming up in our series. So for the next session on we have finding support in Bromley, and we are looking forward to being joined by a lot of organizations in the Bromley community, such as Bromley Well, Thakre Williams, Wolfich Home Care, and we hope to see you online for that as well.
And just to say finally, should you kind of like what you have heard about the Rainbow Care Group and you'd like to come along to one of our clubs for a free taster day, just get in touch with us. That's something we offer where your loved one can attend a full day from 10 a.m. till 4 p.m. No cost or obligation, just try it out and see how you get on.
One more thing I would like to add up is we do experience days for even people who are not directly affected with dementia, just to come and see what we are doing, right? So that they can help other people make informed decisions and just understanding that what is happening in the community, what kind of support is available. So it would be great fun. You can come in at the club for tea or coffee. We can have a chat, and I can show you around what we are doing. Right? So it would be fun. And if there is anything, you can always ring us or email us. So yeah, thank you so much for coming today. Any questions, please let me know.
Well, thank you very much, and well done for all the work you're doing. It's great. As I say, my relative is actually in a care home, so a lot of the stuff you've been talking about, they're providing that. But it's been very, very interesting.
Yes, very helpful.
Thank you.
Thank you.
Right. Okay. No worries.
Thank you. If anyone does have any other questions, just shout out now, put your microphone on or put it in the chat.
Yes, please don't be shy.
Yeah.
If you don't have any questions, it means that either we have done really good job or we didn't do any good job. So don't know which one it is. I hope it is the first one. But anyways, Thank you so much for joining, everyone. I hope to meet you all in the next session, right? Uh, yeah. Thank you so much.
Thank you.
Thank
Thank
you
you very
very
much.
much.
Thank you. Bye bye.
Bye.
Take care. Bye-bye.
Bye.